All right, guys, we're going to start on chapter 3, and this chapter is only 20 slides, so it's not too bad, and it's not the funnest chapter to talk about because it's about cancer, but it's part of the text, so I've included it, and I think that it's important because you guys will run across some clients that have cancer or have other neoplasms going on. Maybe they're not malignant, or they're having a family member that's going through that, and hopefully you guys will be able to have some basic knowledge about that. All right. All right, let's get to it here. So let's talk about cancer. Get to the front of this PowerPoint here. All right, this is chapter 3. We're going to talk about neoplasms. I think the chapter mainly talks about cancer, but we'll go through this. Neoplasm we talked about in the last PowerPoint lecture is just new growth. A tumor is a swelling or a neoplasm. Leukemia is malignant disease of the bone marrow, and a hematoma is a bruise or a contusion. Cancer is the general term for a malignant tumor or a neoplasm, and those are going to be classified by their appearance and their growth pattern, and like I said in the last chapter, the type of body tissue from which they arise. So if they find the cancer in their lymph nodes, but they say that it was started in the brain or vice versa. So neoplasms can be classified as benign or malignant, and then malignant are going to be classified as carcinomas, sarcomas, or leukemia. A benign tumor is usually going to be confined to a local area. It's not going to spread. They're commonly called tumors, even though they're benign, and they're usually harmless. Now, not always. I have heard of a brain benign tumor causing problems because of even the small growth that it does causes problems sometimes with vision or memory or other problems, and they'll actually have to go in and take it out even though it's a benign tumor. A malignant tumor just means deadly. A malignant tumor generally is going to kill someone if left untreated, and it can spread to other areas by invasion, spreading to the surrounding tissues, or by metastasis, which means it can spread to distant areas. Like you can have it in the pancreas or the colon, and also in the brain. Like it can be two totally separate areas. Invasion and metastasis of cancer, carcinomas, and epithelial tissue neoplasms are commonly spread. The lymph nodes are what filter the cancer cells. So lymph nodes are generally, not always, but generally involved in different, especially like breast cancer, I think has a high lymph node involvement. Absence of lymph node involvement, however, is favorable because that makes a surgical cure possible because they can just go in and take it out. Excuse me. Sarcomas shed their cells into the bloodstream. There are different grades and stages. A grade just determines the degree of the abnormality of the cells, and staging it considers the degree of the spread. So when we talk about causes, many cancers, they don't know. They have no idea what's causing them. They're not going to say, like when I was growing up, I used to hear like Teflon from pans causes cancer. The plastic that you microwaved causes cancer. There were all sorts of things that they thought caused cancer. And I like to tell people whatever's good for you now in 10 or 20 years, they're going to say is bad for you because coffee went from being good to bad to good. You know, I never can keep up with it if it's good or bad. Or smoking has always been bad, I think, although years ago they didn't know how bad. Alcohol, they used to say a glass of wine a day was good, and then it was bad, and I don't know if it's good again or not. But prevention and a cure frequently depend on finding what started it, the initiating agent. Causes of cancer, again, chemical carcinogens, hormones, especially with women in breast cancer is often related to hormones. I'm honestly not sure about ovarian cancer, if that's, I would imagine that it is, but honestly, I don't know. Radiation can cause cancer. That's why they have you cover parts of your body a lot of times when you're getting an x-ray that isn't being x-rayed. Viruses, and then a genetic predisposition. Because when you think about like these little babies or small children who get cancer, and you wonder like what in the world, why would they get cancer at such a young age? It's not like they've been exposed to a lot of things. Personal risk behaviors that can cause cancer: diet, sexual behavior. There are they talk about there's a cancer, not ovarian cancer, cervical cancer, that they're saying now is related to a sexually transmitted disease, HPV, and they have a vaccine out now for that. Alcohol use, we know, can cause problems with our pancreas and our liver. There are some things that you can do to prevent cancer, although I don't know that if you do all of these things, you still could get cancer, but they say that these are good preventative measures. Not smoking, limiting alcohol intake, protecting your skin from excessive sun exposure. That one, I think, while it can't prevent all skin cancer, I think that it's good. Refusing needless x-rays, I talked about that just a minute ago. Avoiding heavily polluted air, following the labels when using pesticides and chemicals. I thought about this actually. We have a camper that has an awning, and I was cleaning it with bleach, and it was dripping onto my head, the bleach was, and my clothes, and I was breathing it in as I was cleaning this awning. And I thought, boy, this can't be good. Maintaining a healthy body weight, regular breast assessment for women, exercising regularly. Something that I think that I talked a lot about last time I taught this class that a lot of people don't think about are testicular exams for men and for young boys. Not young, but starting with puberty, having boys and men do testicular exams, because that's about the only way that people are finding testicular cancer. Routine HPV vaccination for girls and boys. I'm a little on the fence about HPV vaccinations. I have not gotten them for my children just because I think that they're so new. I'm not against them. I'm just on the fence about those. There's so many stories about people not doing well. I definitely get my kids vaccinated, but I'm still on the fence about this one. Regular checkups by a physician. Here we talk about clinical breast exams for females, mammograms at the age of 40, and then pap smears for females. I think that pap smears are clinically indicated, I want to say at the age of 18, or if somebody becomes sexually active, I want to say is the clinical guidelines, but I'm not 100% sure on that. Prostate exams for males and rectal examinations for males and females. I always like to tell a funny story about prostate exams. When I worked at a hospital in Aurora, they were giving free prostate exams for men over a certain age. I can't remember. There may not have been an age requirement on it, but we had this elderly woman who came in, and she was just insistent that she get her prostate exam. And they tried to tell her that she didn't have a prostate and that was only for men. And she just wanted her free exam. And I think eventually they did convince her, but it was difficult. All right, frequency of cancer. Cancer is for sure a leading cause of death in the United States. And cancer incidence is higher in men than in women. It does affect people of all ages, unfortunately, both male and female. And the most common types of cancer are basal and squamous cell skin cancer. That's the most frequent. And I think it's just because the other incidents or the other types of cancer are very common, but this one affects more people. The most common, excluding when you take out skin cancer, is lung, colon and rectum cancer, breast cancer, and prostate cancer. And I'd say out of all of those, lung cancer is probably the worst. Pancreatic cancer and lung cancer, in my mind, are two of the worst of those. All right, something you do need to know for your exam are the diagnosis of cancer warning signs. And this is an acronym that is on your exam word for word, and I want to say it's worth quite a bit of points. So many points for each letter, and you need to be able to put the acronym and then put each of these sentences behind it on pretty word for word. But looking for the warning signs of cancer is the caution acronym. Do they have a change in bowel or bladder habits? That's going to be indicative of a lot of things, but a lot of times colon cancer, bladder cancer, their prostate cancer, a lot of those will have a change in bowel or bladder habits. Pancreatic cancer. A sore that doesn't heal is a very good indicator. Just because you have some of these, I don't want you to think that you have cancer, but it's definitely worth, when you do have one of these, it's worth getting it checked out. And so a sore that doesn't heal, and I'm not talking about 3 or 4 days here, I'm talking you're a month out and this sore just will not heal. Good time to go get it checked out. Unusual bleeding or discharge, thickening lump in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in a wart or mole, and a nagging cough or hoarseness are all indications of those cancer warning signs. And again, disclaimer, just because you have one of these doesn't mean that you have cancer, but worth getting checked out. All right, diagnosis of cancer. Its prognosis is best if it's treated early. Routine screening is helpful. Sometimes it's found accidentally. And once discovered, they always recommend, or almost always, a biopsy of that. Some more signs and symptoms of cancer: pain, obstruction, hemorrhage is bleeding, anemia, fracture, infection, or there's that term again that I hate to sound out, but that's the wasting. That's what we talked about in the last chapter. That's just that failure to thrive, that wasting away. There's different types of treatments. Palliative treatment is prevent pain and discomfort. That's not going to cure it. And so, like I talked about, my grandmother died of cancer of the kidneys, and we found out the day after Christmas, I want to say, and she was put on palliative care, and she passed away in March. So she lived about, I don't know, 2.5 months on palliative care, but it was just making her comfortable. And then preventative care is preventing the disease from ever starting. That's pretty obvious. And then finally, I think we're getting close here. Yeah. Cancer treatments, they're going to do surgery, chemotherapy, radiation. If that cancer is a hormone-based cancer, they might be doing hormone therapy. And again, just looking for the cause. What has caused this? What's the reasoning behind them getting this? All right, if you guys have any questions, feel free to message me, and we will get it covered, and I will message you back, or you can email me, and I'll answer those questions. Or if you have any stories to share that aren't a HIPAA violation, feel free to share those. I know that most people have been touched by cancer at some point in their lives, whether it be a family member, a friend, an acquaintance, or themselves. Like I said, I have a sibling who's had cancer. Both of my grandmothers have passed away from cancer. This is not an uncommon thing in this world, unfortunately. And so we just have to keep looking for that cure and be there for our patients our clients, when they discover either that they have cancer or somebody that they know does. Now you guys have a little bit more information on what it is and how to better help your clients. Have a great day.